Hello, everybody. And thank you so much, Maria, for that warm introduction, and thank you for the invitation today. You know, over the years, I've found that when discussing the issue of diversity among caregivers, I like to quote Dale Bera, son of Yogi Berra, who said, "Our similarities are different." As you've heard, becoming a family caregiver is a role that many of us will play at some point in our lives. How we play that part is rooted in our philosophical orientation and the unique strengths of our cultural backgrounds. For African American caregivers, research suggests that their use of the more positive reappraisal when providing care may be an important intervening variable for moderating feelings of stress. Now, being able to reframe situations in positive terms is a powerful tool, and it's a powerful coping tool when dealing with family members who have dementia. So being able to say to yourself, "This too shall pass," really can be the difference between surviving and thriving as a caregiver. Over a decade ago, the California Caregiver Resource Centers began to use the evidence-based program, Powerful Tools for Caregivers, throughout the state of California. Now, Powerful Tools for Caregivers is a highly successful intervention program that is based on the chronic disease self-management program developed by Dr. Kate Loring out of Stanford. And what I found is that several parts of that training program really tap into the coping styles and strengths of African Americans. For example, the tools that are taught include, but aren't limited to, things like use of prayer as a form of relaxation, understanding the power of optimism, learning acceptance, and highlighting the importance of using family and community as part of your caregiving network and tool. The skills that are emphasized in the training are really related to mediating factors that are often associated with lower levels of depression and higher levels of resilience among African American caregivers. Another evidence-based program that we use within the California Caregiver Resource Centers is the Resources for Enhancing Alzheimer's Caregiver Health, and you've heard that program, which is REACH, and then there's REACH 2 model, and that's by Dr. Dolores Gallagher Thompson and colleagues. Now, parts of this national research program were specifically targeted to African American caregivers, and it combined the care recipient, focused behavior management skill training, and the caregiver skill building training. And the results, when they were looking at what happened with this training, is that they found that the greatest improvements for African American caregivers occurred among those who participated in the skills training intervention. Now, I just highlighted two programs which seem to be well suited for providing education and training to African American caregivers. But it's also important to remember that there are community-defined practices within ethnic communities that really yield positive results as determined by the community consensus. So while we have our evidence-based practices, another form of evidence-based practice really should be these programs that are community-defined. They may not have been measured, and they may not be empirical by a specific process, but they really have a level of acceptance by the community. Such practices including partnering with faith-based organizations and community organizations, integration of food when you're doing things, using a personalized approach, and involving key members of the community as both in the program planning and outreach. Now, in LA, we recently partnered with First AME Church to provide caregiver support as part of the Women's Missionary Society. And that missionary society is responsible for identifying caregivers in the church and inviting them to attend a support group. And it's a very friendly, personalized invitation. They also serve on the advisory board of the caregiver group, and they are responsible for identifying caregivers within the church and inviting them to the support group and doing the evaluation. So far, I've touched on only a few of the differences for African American caregivers, and I want to conclude with my recommendations. So first off, I would like to say we need to assess and identify caregivers within our system in a consistent way. And so they maybe put them as part of the medical record. So we have to recognize caregivers, and this has been said by the earlier panel. Education clearly is important, and the models of education need to be personalized for the group and for African Americans. We find that education is lacking, and that's one of the things that's often repeated for African American caregivers. Spirituality, oops, went too soon. Spirituality is an important part and piece of what is done within our communities, and it needs to be recognized and used as part of interventions. Someone had mentioned, and I think it's very important to realize that for African American caregivers, they're more likely to be caring for parents as opposed to spousal caregiving, but they're also in the role of grandparents taking care of grandchildren. So we have two populations of caregivers that we need to target within our community. I'm going the wrong way, sorry. We need to engage the family caregivers support system and as part of the social system and as part of the solution for looking at ways to help caregivers and looking at that evidence-based practices. So that's that community-defined practice. We can't forget that this is an important piece and model that we should be using. Finally, training for caregivers and professionals. So while the caregivers want skill-based training, we also need to emphasize training for professionals so that they know how to communicate with our caregivers, that they understand behavior management skills, and that this training is focused. Now, one of the things I'm hoping that you will notice, if you look at the first letter, R-E-S-P-E-C-T, that is my last message. So, in case you didn't notice, my last message here is that you have to incorporate respect. There's respect into our policies and practices and programs. Respect is a value that is similar across caregivers, and that was said much earlier, but also, as the African American proverb says, those who respect the elderly pave their own road toward success. And so with that, I will end. Thank you.